So who's been here, who here has been to a hospital in time? Like, recently? How long was your wait? Roughly? Hours? Hour?
2 hours.
Anybody here? 3, 4 hours?
I got right in.
Yeah.
I came in an ambulance, so.
Oh, okay. Well, we're going to talk to you about the Affordable Care Act. It's real affordable. Who can afford it? Under what circumstances? Who benefits? Who doesn't? Just my proposition statement here is the Affordable Care Act will negatively impact healthcare. This reason number one: the Affordable Care Act is not accepted everywhere. Third of physicians refused to accept new Medicaid patients in 2015. Support that. Just, with Medicaid's expansions and government cuts, the numbers of doctors who don't take Medicaid skyrocket. That's according to a 25-year surgeon who worked at a Children's Heart Hospital. It's also, this is all the facts I'm going to present here to you from the Wall Street Journal, that particular article. Medicare, this is the second statement, Medicare only reimbursed hospitals and doctors for 70 to 85% of their costs, meaning over that, they're losing money. Once it's cut, further reduced reimbursements, and the Affordable Care Act added stacks of paperwork, more doctors refused to accept Medicare. It just didn't cover their expenses. They weren't making the bottom line. Some physicians now even refuse to take patients over 50 years old, not wanting to be burdened with them when they reach Medicare age. What is it, 65? Everyone know that? This third support effect, the loss of private practice is another big problem. So because of regulations and other government disincentives to self-employment, doctors began working for hospitals in the early 2000s, leaving less than half in private practice by 2013. The ACA rapidly accelerated this trend, so now very few private practices remain. When doctors are self-employed, like factory workers, studied by from the Medical Group Management Associations and others indicate that productivity falls, sometimes by more than 25%. Simply they get tired of having just patient after patient after patient. They just can't keep up with it. When their shift ends, that's it. They're done. They're not going to do more follow-ups. They're not going to keep up as well as maybe they could. Last important detail here is the traditional doctor-patient relationship is now reserved primarily for those who can pay extra. Of those doctors still in private practice, many have taken refuge from the healthcare law by going into concierge medicine, where the patient pays an annual fee typically ranging between $500 and $3,000 annually per individual to a primary care physician. Patients who can't afford concierge medicine but have seen the doctor take that route are out of luck. So to wrap it up, just the Affordable Care Act will negatively impact healthcare. Just it's not accepted anymore. Medicare only reimburses hospitals and doctors 70 to 85% of the cost. Loss of private practice is just cutting into, every doctor's going to be the same. They're not going to take the same care of you because you can't afford it. It's just for those who pay extra. To tie it all in, this is just a small quote. It's also no wonder that 3 years ago, members of Congress got themselves exempted from the Affordable Care Act. They may have passed the law, but they're not stupid.
All right, Modesto, the audience survey at the beginning kind of identifies what the topic area is. It got to be a little problematic because you kind of get sidetracked on some issues, and that's a distraction. Your proposition is clearly stated during the opening part of the speech. I appreciated that. The contents, it sounds like you're going to do a preview, but basically you just start listing what the issues are and you start presenting those issues as you get to each of them. So there's not really a roadmap of where the argument's going to be. I suspect that there's plenty of controversy on this, and most people are aware of the disputes being made about the Affordable Care Act, so you're probably okay there. Internally, I could hear you signposting the points, but there was a little bit of confusion because at one point, when you started talking about the loss of private practice, it sounded to me like it was a second piece of supporting information on the first point that you're presenting, but it turns out that it's actually the second supporting point in your argument. That's one of the things that would have helped if there'd been a preview. We would have known that that's really a distinct point from the first point because we'd heard that it was coming up and it wouldn't have been conflated with that first point. So you need to have that kind of structural preview to help us. You've got some statistical information in the presentation, some anecdotal experience that you're sharing with us. That's okay. It does, like you say, all come from the same article, so it sounds like it's a little bit thin here. A couple of the experts that you're citing, I mean, the person that we get quoted in the article is a 25-year physician. They're talking about their own personal experience, I assume, as opposed to being able to generalize about a broader set of experiences. If there is some information that is based on broader experience, it would be helpful if you could tell us that they were an administrator in a hospital where they were running into those problems, or that they had had contact with other people, or maybe they'd even done some research on this. Otherwise, it just sounds like it's this one person's personal experience, which is not a bad way to get started, but it is just example evidence at that particular point. The information that the Wall Street Journal cites for statistical information, they're a credible source, but I'm sure that they didn't conduct this research on their own. They're reporting something that came up. It may have been in the article, and it would be helpful if you would cite that as well. Like I said, I think that when you got to the third point, you did signpost that a little bit more, so I did know that that was a distinct supporting point in the presentation. I think your presentation is a little casual at times. It feels sometimes like you're, you know what the issue is that you want to talk about, but you haven't planned it as well as you need to in order to make it an effective speech, and so you're kind of winging it a little bit, and it should be a little bit more forceful than that. I did think at the end of the speech that there was kind of a summary of what the argument was, and although the secondary points that you're listing in your summary are not exactly the same thing as you had in the body of the speech, I could see generally how you see this argument developing and what your general criticism is at the end. And I thought that the example of exempting the Congress from the Affordable Care Act was an interesting illustration about how you could see or be suspicious of whether or not it's going to be effective, and whether or not, for instance, elites are going to be treated differently than everybody else, which is your third point. All right, thank you.